atrium is one of 4 chambers of the heart and is responsible for receiving blood from the lungs and pumping it into the left ventricle, which then pumps the blood into the rest of the body. An abnormality in the structure or functioning of the left atrium, known as atrial cardiopathy, can often serve as a biomarker or predictor of a person's cardiac risk. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and today I'm going to talk about a higher risk of dementia if an upper heart chamber is abnormal. Structural or functional abnormalities within the heart's left atrium with or without symptoms may increase a person's risk of developing dementia later in life by 35%, according to new research published in the Journal of the American Heart Association. Dementia risk increased even among those who did not experience atrial fibrillation or stroke, two conditions known to be associated with dementia. Atrial cardiopathy is associated with an increased risk of stroke and atrial fibrillation, which are both linked to an enhanced risk of dementia. In a study led by Michelle C. Johansen, research team aimed to determine the relationship between atrial cardiopathy and dementia, and if so, whether it's independent of atrial fibrillation and stroke. This analysis uses data and assessments gathered during participants' 5th ARIC clinical visit between 2011 and 2013 as a baseline, and follows the participants through their 6th visit between 2016 and 2017 and their 7th visit between 2018 and 2019. The current analysis included 5,078 of the 5,952 participants who returned for their 5th clinical visit. 59% were female and 41% were male. The group of 5,078 were an average age of 75 years old, and 21% self-identified as Black adults. During their 5th, 6th and 7th clinical visit, the ARIC participants were evaluated for cognitive decline, indicating dementia. The analysis of the collective health data found that throughout the more than 70 years of follow-up, 763 people developed dementia and 1,709 had atrial cardiopathy. The participants with atrial cardiopathy appeared to be 35% more likely to develop dementia. When the researchers adjusted for participants who experienced atrial fibrillation and stroke, even after accounting for other vascular risks, they still observed a respective 31% and 28% increase in dementia risk in patients with atrial cardiopathy. The researchers suggested that a state of atrial cardiopathy leading to dementia is not a result of atrial fibrillation or stroke alone. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.